My name is Alina Zahir, and I want to tell you exactly what Tribal Roots Africa is trying to do with telemedicine, call it telehealth, and how we see how we can change the health landscape and make sure that the health services are reaching the far and remote places in Africa. Supported by the young professionals in the medical field who are dedicated and saying, yes, we can change this narrative. There are very many challenges existing in the health department or the health system of Africa. And many of those have everything to do with a lack of accessibility by most of the people who live in the remote places. They cannot access the big hospitals. And even when they can, they cannot afford the very high prices of medical services. In Uganda, statistically, the doctor-to-patient ratio is 1 to 25,000. Just imagine that. And yet, every year, we have hundreds and hundreds of medics graduating from medical schools, from universities, and still finding it very hard to get jobs. Telemedicine Africa and the mobile health and the medics are coming together as professionals who are saying, yes, we can fix Africa, and Tribal Roots Studio is here to support them. We would like to implore all of you to join this big and very noble effort by the young medics in Uganda who are saying, yes, we will reach the remote places, we will reach the refugee camps, we will help the mothers who need maternity care, we will also help the elderly, and we will also stop very many deaths which are happening, people dying from preventable sicknesses. We will help our people in Africa, and all they need is your support. We have a medical student who is with us today, and he is explaining some of the challenges as they have found out in their studies, in their practice, and stay tuned for more. Thank you so much for supporting this Telemedicine Africa project supported by Tribal Roots Studio. We would like to move with you on every step of the way, and we will win together. Thank you so much, and God bless you.
Hello viewers, warm greetings from myself to you. My name is Derek, a student of medicine and a very strong proponent of telemedicine and its impact in the global health system, most importantly in our African setting. Innovation over the years has been the greatest fiber for the existence of humanity. From the analog computers to the analog calculators, Charles Babbage to Mark Zuckerberg, the innovation has been the greatest thing that ever happened to humanity. Telemedicine, in the same way, is the greatest innovation that ever happened to health. From the wars in recent history, the Second World War, where soldiers in Germany were able to use telegraphs to communicate to their counterparts in the far eastern parts of South Britain. From our ancient ancestors in Africa, who used smoke to warn of a serious upcoming plague in the community, to a nearby community. To all other stories, telemedicine is the greatest and most integral thing that can enable a patient and a doctor, a community, and the next to share vital and very important information that can be very key for diagnosis, treatment, in general, clinical services. On the backdrop of the COVID-19 pandemic, society has got to realize that, yes, we can have breakups, bottlenecks in communication flow. Let's take an example. A patient just got burnt, the whole body, 90% covered with burns. But perhaps they fear the risk of sepsis in a hospital. Or let's say, a patient that probably, due to their own reasons, finds the nauseating type of nature in the hospital so disturbing for their recovery and chooses to stay home. But the doctor would really want to keep tabs on this patient. Telemedicine would offer the utmost and very, very efficient solution to connect these two parties, to enable healing, to enable easy monitoring, care, nursing solutions in the name of telenursing, nursing evaluations, and also in very key diagnoses that may erupt along the process. Therapies that may even include telesurgery, just from a doctor to the patient. If you brought this home, of course, I do realize any shortcomings, any emerging bottlenecks to this. But with the emergence of broadband internet, the use of 5G or 4G, efficient Wi-Fi solutions in our community, and governments taking center stage to provide connectivity, I believe there will be a day whereby the hospital will actually be a hospice. A hospice is a place where only terminal illness should be managed. I believe the hospital should be that. Let's take another example rather. We have a doctor that has managed the patient for 2 years, probably for a terminal cancer or something. And this doctor perhaps got the chance to maybe work in another part of the world, but still wants to keep tabs with this patient. In a way, keeping up with the continuity of monitoring the patient as an individual doctor and not allowing any other doctor maybe to cause a cocktail in the treatment of this patient. Wouldn't we think of telemedicine as the best way for these two to keep in touch? Let's also take an example. Another COVID happened, and God forbid, let's say a pestilence as high and as grandiose as maybe the bubonic plague. Yes, I realize advancements have changed and maybe a vaccine might take 2 months to make next time. But yes, this one comes and maybe it's so weightier, way heavier, and any kind of contact, this time around not airborne but skin contact, would be a very, very serious problem as to cause serious damage. What would we resort to? Telemedicine. This, as much as is a suggestion, is also an instruction to our communities, our leaders, health system, ministries, and individuals down in every capacity to think of this as a revolution. Telemedicine is the very greatest thing that ever happened to health. Let's call it telehealth. Let's call it anything. Telemedicine can change things. Africa has been a panacea of disease over the recent years. Many years. From prehistoric time. Cholera, Ebola, the Marburg, or even the Nyugu virus, or the chikungunya. Africa has been known for the most contagious diseases, transmission at breakneck speeds and everything. Getting to decrease contact between service providers and patients has always been a challenge in many health systems. In Uganda, many people talk about the great doctor in northern Uganda, who in the year 2000 lost his life to save patients of Ebola. Just in the recent past, our neighbors in the West Africa, Sierra Leone, Liberia, among others, had the greatest surge of deaths they had ever seen in their land, all because of the impact of contagion, disease transmission that can be reduced if we just understood that we do not need to meet sick people, that we need to keep our healthy doctors away from the sick patients so that they can be able to save other sick patients. In the DRC, neighboring Uganda, or even in Uganda, in parts of Uganda, there has been a very serious outcry of Ebola, time and often. And one of the biggest limitations to therapy and health service promotion has been the issue of contact. With telemedicine, we can be able to have that problem, or even find a lasting solution to it. Let's imagine again the use of telediagnosis, that wherever you are, government, through other systems, can be able to provide solutions that can be used for diagnosis, and the patient can be able to self-diagnose and report that to the doctor via the use of maybe video conferencing. The doctor, in a way, one, would be saved the burden of having to move, because there are lots of patients they will have to see. The doctor, in another way, would be having the feasibility of having to get a report from every patient and the way that they are. Because anyway, if you instructed a nurse to do that, the nurse could also have gotten tired and maybe handled a few out of the many. In this way, due to instruments such as video conferencing tools or even the telephone, patients can keep very close contact with the doctors who will be efficiently, in a way, observing them. I do believe that disease has become a very, very serious concern for the 21st century and possibly centuries to come. It is time for the continent, stakeholders, the African Union, to find lasting solutions to global health promotion and health facilitation. If we talk about 2063, we should also talk about the importance of health being part of the Vision 2063. I believe with the impact of good health, Africa can be a very, very efficient and productive society, like the rest of the world has been. To all people outside Africa, we also ask you to aid this, be a part of this movement. This will save lives and also aid life. The greatest strength of good health systems has been the 3 A's, what people in public health would call affordability, accessibility, and acceptance. With telemedicine, anybody that tries to address these issues will have given a very strong boost to this movement. The patients in Africa have issues perhaps of finance, or even their cultural heritage in a way. That impedes their acceptance and as well also their affordability. Not forgetting the hugest and biggest problem in Africa, one of the biggest problems in Africa, which is connectivity via infrastructure. So that also hinders accessibility. Telemedicine, in a great way, and why we're in this journey together, will help answer these problems. The questions have been stated clearly, and the answer is clear. Telemedicine. Imagine having, with the advent of better connectivity, I prefer to use the great advantage of examples in my explanation again. A patient in Karamoja who wishes to see a doctor in Mulago, perhaps a doctor who is already fatigued up, or maybe fears the teapot tempest journey that he might have to endure to get to Karamoja. using telemedicine, such a patient would be able to half how much they would spend to get to see this doctor. They'll be able to book an appointment easily instead of having to line up to see that doctor. They'll be able to have better monitoring as they have direct access to this doctor, not through the nurse, not through anyone. So I believe that using this system, telemedicine can really shorten what has been a very long and strenuous journey to provide health care to the people in Uganda and the rest of Africa and the world in general. So one of the biggest implications and difficulties that have been asked about telemedicine is the issue of self-diagnosis, individual monitoring of a patient without having to see a doctor, let's say. Well, that is as good as answered by the question itself. Telemedicine would make the cost of providing health care to these patients cheaper, and it would also enable as many nurses to be in touch with people who may want to self-diagnose. Say, why do people anyway self-diagnose? Because they don't want to go to a hospital. With telehealth, telemedicine to say, patients would get to easily meet a doctor or a nurse who would aid them in providing a diagnosis or even going on to provide therapy for their illness. Telemedicine is that integral, that intrinsic, that very important to the health system.